Hello physios, get back to my channel. Today we learn on topic on larynx. As it is a voice box and anatomically, and here you can see in this picture. So what are the surrounding structures of larynx? As it is present in the neck. What is the extension? Your extension, it is from epiglottis to the cricoid cartilage. That is your upper border of epiglottis to the lower border of cricoid cartilage. Larynx, actually it is an organ of phonation and respiration. It gives both sound and respiration. And its communications, it is between the larynx and pharynx. So it is called as laryngopharynx. As it will be present at the level of C3 to C6 vertebra, and it has some of the constitutions, like as it is made up of skeletal framework, cartilages. It gets connected to the joints, ligaments and membranes. So it has some of the cartilages, like it has 9 cartilages, and there are 3 unpaired and 3 are paired up. Your unpaired cartilages are thyroid, cricoid and epiglottis. Your paired cartilages are arytenoid, corniculata and cuneiform. Your thyroid cartilage, if you want to write elaboration, write 3 points for every cartilage. Like thyroid cartilage has, it will be in V shape when using cross section, and it consists of right and left thyroid cartilages in lamina, and this lamina will be in front forming a thyroid angle, and thyroid angle, it will be different from male and female. In males it has 90 degrees and in females it has 120 degrees. Right, these points are enough about thyroid cartilage. Next, cricoid cartilage, has, it is in ring shape and its complete cartilage, it is thicker and stronger than thyroid cartilage. So you can also write like it has anterior part which gives arch to the cricoid, origin to the crico and thyroid muscle. It gets attached to the thyroid muscle also. And epiglottis, has, it is in leaf shape in the anterior wall of the larynx, and it keeps inlet of larynx patent for breathing, and it constitutes upper end, it will be free and gets connected to the tongue in the upper part and lower part to the hyoid bone. Enough for this epiglottis. Then next, coming into the paired arytenoid cartilage, like it has an apex and base. Your apex, it will be upwards and medial directed, and base, it has a lamina of cricoid cartilage, and your vocal process or attachments to the vocal cords, and there is muscular process, like it get attached to the mucous membrane. Your arytenoid cartilage tells about your apex, base, vocal process and muscular process. Next comes your corniculata or Santorini cartilages. There are 2 small cornicular nodules which articulate with some apex of arytenoid cartilage and lies posterior part of the epiglottic folds. Then cuneiform or Wrisberg cartilage, has, it is 2 small rod shaped pieces of cartilage placed in the epiglottic folds. Then you draw the diagram in this way, and you made for color for attraction so that you can learn very easily and you can score marks also. And some movements like abduction, posterior cricoarytenoid, adduction of the larynx, that it is useful for your speaking and respiration, so it can do these movements. And elongation of vocal folds is by cricothyroid, and relaxation of vocal folds is by thyroarytenoid cartilage. Your blood supply, it is your laryngeal artery, that is your superior and inferior laryngeal artery, lymphatic drainage, prelaryngeal and jugular-digastric lymph nodes. Nerve supply, it is all the muscles by recurrent laryngeal nerve, but except cricothyroid, it is by your external laryngeal nerve. Next, while you're ending up, try to sure that applied aspects of larynx. As infection of larynx, it is called as laryngitis. Then it is characterized by your hoarseness of voice. And there is teacher's nodules or singer's nodules. They use very sarigamapa in that way, and it may be shout or you may have some anxiety speaking more. So it may if you misuse of vocal cords may produce some nodules on the vocal cords at the junction of anterior 1/3 and posterior 2/3. So these are called singer's nodules or teacher's nodules. Enough for the applied aspects. So once again, larynx, the voice box, structure surrounding the larynx, your extension and its communications, cartilages, paired, unpaired, diagrammatic, your movements, blood supply, nerve supply, lymphatic nodes and applied aspects, right, and your nerve supply. These are the points to be covered up in larynx. Thanks for watching SPN.